Hello everyone, my name is Evelyn and my presentation will focus on the oral microbiome and its connection to periodontal disease. The oral microbiome plays a crucial role in maintaining balance within our mouth, and when that balance is disturbed, it can lead to inflammation and gum infection. I'll be explaining how this process happens and why it's so important to oral health. Periodontal disease causes chronic infection of the gums and tissues around the teeth. It starts when plaque builds up and bacteria release toxins that inflame the gums, and if it's not treated, it can lead to gum recession, tooth loss, and bone destruction. Caused by Phorophyromonas gingivalis and other harmful bacteria, which these bacteria live in deep gum pockets where there's less oxygen, and it's the perfect environment for them to grow. Overgrowth of P. gingivalis and other harmful bacteria disrupts the balance of the oral microbiome, influenced by the imbalance in mouth bacteria, poor oral hygiene, smoking, weak immune system, commonly seen in adults over 30, smokers, diabetics, and people with poor oral hygiene. How it appears: red, swollen gums, bleeding when brushing, resetting, gum line, and loose teeth. What it may feel most are asymptomatic, but some feel sore, tender gums, bleeding, bad taste, or even bad breath. Epidemiology research shows that periodontal disease affects nearly half of the global population, mainly due to microbial plaque buildup that disrupts the oral microbiome balance. Oral microbiome and periodontal disease. Imbalance of oral microbiota can lead to periodontal gum disease. Healthy mouth equals balance between good and bad bacteria. When harmful bacteria overgrowth, it causes infection and inflammation. Balanced microbiome keeps gums strong and protected. Happy bacteria, happy mouth. Unbalanced microbiome, harmful bacteria equals gum infection and infected gums. Meet the good and the bad microbes. So the good, they're made up of many helpful bacteria that protect the mouth, help maintain balance and support healthy gums, produce substances that fight harmful microbes, keep the immune system strong and controlled. Some species help prevent inflammation and plaque buildup. The bad. When balance is disturbed, bad bacteria take over. Overgrowth of P. gingivalis and others leads gum inflammation, bleeding, and tissue damage. Creates pockets of infection under the gum line, may cause chronic periodontitis, can also affect overall health if bacteria enter the bloodstream. Mechanism of harm. Once there's disturbance in the oral microbiome, harmful bacteria like P. gingivalis releases toxins that trigger inflammation, causing damaged gum tissue. Over time, the gums pull away from the teeth, forming pockets where more bacteria collect. Chronic periodontal disease causing to enter the bloodstream, linking oral health to heart disease and diabetes. Any studies? Genetic and inflammatory factors in periodontal disease shows that it's caused by both bacteria and genetics factors. Inflammation plays a major role in gum tissue destruction. Share gene links periodontitis with heart disease. Studies show over 60 genes associated with gum disease. Conclusion: periodontal disease is not only a mouth problem, it's linked to systemic conditions such as heart disease, diabetes, arthritis. This connection emphasizes the importance of oral hygiene, early detection, and personalized treatment to prevent further complications. Future studies. Future studies should focus on how oral microbiome balance affects systemic diseases like heart disease and diabetes. The role of specific bacteria, P. gingivalis, T. forsythia, in early inflammation. How genetics and immune response influence gum health and developing new probiotics or therapies to restore balance. Until then, floss and brush twice daily, clean your tongue and gums, schedule regular dental checkups, avoid and limit sugar, stay hydrated to support healthy bacteria. These are the articles and slides I used to complete my research. That concludes my presentation. Thank you all for watching and learning with me about the oral microbiome and how it connects to periodontal disease.